Hi everyone. Recently, Jenna Fischer, the actress from The Office, shared that she had been diagnosed with triple positive breast cancer. Let's talk a little bit about what that means. A triple positive breast cancer is a breast cancer that it expresses the estrogen receptor, the progesterone receptor, as well as the HER2 protein. You hear a lot about hormone receptor positive breast cancers. These are breast cancers that are treated with drugs such as tamoxifen or aromatase inhibitors. But let's talk a little bit about HER2. HER2 positive breast cancers account for about 20% of all breast cancers. And essentially what a HER2 positive breast cancer is a breast cancer that overexpresses the HER2 protein. And that is what drives the growth of the cancer cell. Now, the cells have the HER2 gene, which makes the HER2 protein, which is a receptor that is on the surface of the cell. And in some cells, the gene essentially malfunctions and makes too many copies of itself, and then that leads to too many copies of the HER2 protein. And when we think about testing for HER2, which we do for all of our breast cancer cells, we do not test HER2 for ductal carcinoma in situ or stage 0, but for the rest of our breast cancer cells, we are checking for HER2. There are two ways to do that. You can actually test for copies of the gene, or you can test for the amount of the protein. And there's two different ways to do that testing: with immunohistochemistry, which is looking at the amount of the HER2 protein, or FISH testing, which is looking for copies of the HER2 gene. In terms of treatment, breast cancers that are HER2 positive require drugs that target the HER2 protein as part of the treatment. And so there are a number of HER2 targeted medications out there. The most common one that we know and think about is Herceptin, or trastuzumab. And Herceptin was approved in 1998 to treat metastatic breast cancer and was not approved until 2006 to treat early stage breast cancer. There are a number of other HER2 targeted medications, including Perjeta, Enhertu, Kadcyla, and others. And they're all used at different points, at different times of the treatment, different stages, disease characteristics, and those are all really individual discussions based on one person's treatment. Now, an important point is that other cancers, not just breast cancer, can be HER2 positive, and we use these drugs in other cancers as well, such as gynecologic cancers and in gastric cancers, for example. HER2 targeted medications can affect the heart, so patients on them are going to be getting routine monitoring of their heart, typically with echocardiograms. One of the things that's exciting about HER2 positive breast cancer is the amount of research that is going on right now. There are a lot of clinical trials looking at novel therapies. There are a lot of clinical trials looking at where we can escalate therapy, where we can pull back or de-escalate on therapy, identifying markers of resistance, markers of response. And there's a lot of research into HER2 vaccines, which is really exciting. And some of these vaccines actually use the immune system to identify HER2 and destroy it on cancer cells. And so I'm really excited to see where some of this research leads. But let me know your questions about HER2 positive breast cancer or HER2 positive cancer in general, and we'll see if we can answer them.